What are you doing?
All right, hello, I'm Patricia White. I am. This is my audience. Can you see? All right. And today we are going to be talking about a common procedure known as the onychectomy, or how it is more commonly referred, cat decline. Vets will have you believe when you go into their office with your cat that it is a simple procedure. It is same day, in, out, no adverse side effects, kind of like if you were getting them spayed or neutered. This is absolutely not the case. These vets are lying to you. What kind of life do you think would be available to you if you had all the tips of your fingers and toes cut off at an early age, before you even got the opportunity to learn how to use them? This is essentially what's happening when we declaw our cats. Life quality would likely decrease for you, and it's the same way with any feline. As a pet lover and wildlife enthusiast, I stumbled upon this information while doing my own research, and what I found out not only shocked me, but it disgusted me. In this speech, I will look to the support of several vets, findings conducted by the AVMA, or the American Veterinary Medical Association, and of course the irrefutable proof of the damage done by decline. So, this is a widely accepted and surprisingly common procedure. It's done on almost a quarter of the cats nationwide that live in households. This isn't even talking about jungle cats that people purchase on the black market, or even feral cats that have gotten loose and become feral later. But as Dr. Jennifer Doherty with the Provincials of Animal Welfare states, it is major surgery. It's very painful, it has serious side effects, and it's not even necessary. Shall we move on to exactly how declawing works? I'm going to denote a few common misconceptions. Most people would assume that when you're taking your cat in for a declaw, it's kind of like a permanent manicure. You're just going in there and you're trimming those claws off a little deeper than you normally would, going underneath the skin as opposed to just above it. This is not true, not at all. When a cat is declawed, it's not like a nail trim. It's a serious amputation, hence the name onychectomy, ectomy meaning to remove. Paw anatomy is fascinating and even a little complicated. Here, as you can see, we have this top phalange. The phalange is the tip bone of your finger, you know that. And here we have the tendon that connects this phalange with the second one and pulls the phalange up and down, retracting the claw in and out. The cool thing about this that a lot of people don't realize is cat claws are not like human fingernails. They're attached to something very sturdy, almost like bone, with marrow and everything. This thing is right here. So you can cut it off almost to the root, but it will still try to grow back. What an onychectomy does, essentially, it snips this tendon right here, and then they remove this bone entirely, which should, in theory, keep the nail from growing back. The thing about this that's really, really troubling, especially for declawed cats, is this bone never stops growing. And sometimes, even when they take this top phalange, it still tries to grow. This is a really big issue for our standard feline friends. The reason being, can anybody notice how they're stepping? How his paw kind of touches toe first as opposed to the ball? When human people walk, we use the balls of our feet to maintain and support our weight fully. When cats walk, they use their toes. Can anybody think of what might happen to a declawed cat if they're constantly trying to walk on their feet and their toes all the time? Eventually, especially if this bone continues to try to grow back, that claw will create massive amounts of irritation as they try and step just day to day, regular everyday living. Because of this, pus builds up infection happens, and it will eventually, best case scenario, lead to the immobilization of the animal. They'll no longer be able to walk because the pain is too excruciating. Worst case scenario, they're going to have their paws amputated. So, this is the case. This is common knowledge. Vets know it. Of course, they have to know it. They have to go to school for 8 years. Why does it even happen? If the vets know the issues, there were some recent studies conducted by the AVMA where a group of roughly 3,400 vets were questioned. Of the 72% that were questioned, they reported performing at least one onychectomy a month. Of the 72% that said that they did perform them, 62% of those said that they performed more than one. This is seriously strange mixed signals that I'm getting. Why is this? Because in the same survey conducted by the AVMA, 74.6% of those same respondents report that they recommend non-surgical alternatives. I don't mean to sound blasé or anything, but if your vet told you they were going to cut off the tip of your cat's finger, would you actually go through with it? I don't think you would. I wouldn't either. So if all these vets recommend non-surgical alternatives, 74.6%, a number I still deem to be too low, why are so many vets still doing it? The bottom line, of course, is money. Many vets suggest a surgery during standard procedures like spaying or neutering. And everybody has their cat spayed and neutered. All good animal owners have their pets spayed and neutered. You take your cat in for a spaying, and your vet nonchalantly goes, "Oh, would you like to go ahead and declaw your cat today? It'll only take me another hour." Most people say, "Yeah, why not?" It doesn't sound like there's anything wrong with it the way he says it. It takes roughly an hour to do. They're getting paid anywhere from $800 to $1,200 an hour to do it. You do the math. I wouldn't turn down that kind of money, although I have morals. So they know it's wrong, and you would think that there would be some kind of rule. Well, coincidentally, technically, there are some bylaws on the issue. Dr. Sia Johnson with the AVMA quotes, "Declawing should only be considered after attempts have been made to stop the cat's destructive use of its claws." The only reason that the AVMA states they even allow it is due to supposed health risks for certain owners with compromised immune systems. Note how it's for certain owners, not for the cat. These policies of declawing, that it should only be done as a last resort, they're treated more like suggestions than actual rules. The reason why I say this is because there are direct statements from vets that contradict this rule by stating that they should decide to declaw their cat before it's even 3 months old. In the documentary film The Paw Project by Dr. Jennifer Conrad, many vets are caught suggesting this surgery to clients for their kittens. Dr. Lyle Brumley states, "It's a lot easier on your kitty to declaw it when it's probably 10 weeks old and weighs no less than 2 pounds. 10 weeks old. These cats don't even know how to properly use their claws yet. They're just now learning. That's why they're scratching everything and messing with your legs all the time because they don't realize it. And it's essentially like you're taking a 3-year-old who's learning how to use their hand for the first time and chopping off the tips of their fingers. That's not okay. I don't think so. But Dr. Brumley, he's the vet, right? You would trust what he has to say, wouldn't you? How can they be getting away with this? Declawing is a serious and invasive medical procedure. It is not simple, it's not effective, but rather a cruel mutilation of one of mankind's closest companions. It's something that's done to benefit people, not the animal itself. And it's very painful, it's very harmful, and it's essentially wrong. You're taking the structure of their paw and completely deforming it. Vets don't tell you that. So why is this mutilation still so widely accepted and performed? Other than the fact that vets don't feel the need to inform their clients about what they're going to be doing to their patient cat, the other answer is quite simple. It's because we allow it to happen. We are ill-informed. We get animals and we trust the people who say that they know about these animals to give us the information that we feel we need to make the right decisions for our pet. But they don't. and it's profitable, so they're not going to start. It's up to us at this point to take responsibility for our knowledge and to be well informed. There are many things that we can do to keep Kitty from scratching us and our things. There's this awesome new invention called Soft Paws. It came out a few years ago. It's essentially like a tiny little glove sheath, like knives, like for knives, but for little kitty claws. They're adorable. They come in all sorts of different colors, and they only need to be applied every 4 to 6 weeks. So for 4 to 6 weeks, you don't have to worry about any scratches on your furniture, any scratches on you, and your kitty can still go through those motions that make him so happy. You can clip them. That is a little bit harsher on your cat, and it's definitely going to be a little harsher on you. It doesn't necessarily make the claws less sharp, but it makes them less effective. Filing will make them less sharp, but it's still just as hard on you. And filing and clipping needs to be done every 2 to 3 weeks. So if you don't want to do it that often, you should opt for the Soft Paws. But declawing should never, ever be an option. Until we do these things, until we take responsibility for our cat's claws, for the well-being of our cat, and the responsibility to be well informed for our own pet and not expect other people to be well informed for us, they will continue to ask, and we will continue to nod ignorantly yes. As long as people are dim enough to say yes, vets will continue to push declawing on us, and it is up to us to know our stuff and to know when to say no. Thank you.